Coalition vision is a future that values and safeguards the financial well-being of older Texans. And welcome, welcome. So happy that you have all joined us today. We have a speaker. We have Paula Johnson. She is the Bureau Chief for the Harris County Area Agency on Aging and Aging Disability Resource Center. The agency is part of a national network that coordinates supportive services for seniors. As mandated by the Older Americans Act of 1965 and its later amendments. Acting as an advocate, the Area Agency on Aging raises awareness of seniors' needs through services that help older adults and their families access options that promote independence, well-being, and dignity. The HCAA or HCAAA programs are designed to address the social, nutritional, educational, and logistical needs of all Harris County residents age 60 and better, right? All right. Paula, it is your lectern now.
I'm on mute, so I was talking to myself.
Oh.
And so thank you, number one, for providing this opportunity for me to speak. And so I'm going to show just sort of one slide because there's a lot. We were fortunate to partner with our adult protective services here in Houston. And we submitted, as well as with UT School of Public Health, and we submitted an application for the RISE grant that came out, gosh, now the years are moving so fast. Earlier, I believe it was early this year or late last year. And we were one of 3 applicants across the United States who were selected. So RISE is, the RISE grant or the RISE collaborative is actually, was developed in Maine. It's an evidence-based program that's dedicated to prevention and response of elder abuse and self-neglect in the community. And so they piloted, the group in Maine piloted this this concept for a while, and then were given funding through the Administration for Community Living to actually then to go out and now to I'm gonna say enlarge their territory, but also to work on their research and open it up to other states to have this opportunity to implement this this model. And so let me share my screen. And what I realized is that I have two presentations mixed into one. And so let's see here. There we go. Let me go up to the beginning. Okay. There we go. All right. So you all can see my screen now?
Yes.
All right. I'm going to put it in presentation mode. Is it in presentation mode for you all? Because I can't see you all anymore.
It's not.
Okay.
We can see your screen, your power there. Oh, no.
I came out. Let me go out and
Yeah.
put it in presentation mode first and then go back in. Okay. And now let me share. There we go. Okay.
Yes.
There we
Very
go.
good.
Okay. So RISE is an acronym. Now let's see if my screen will advance. Come on. There we go. Okay. So as we know, elder abuse affects millions and justice requires holistic community-driven approach. And with the RISE model, as I said, the RISE is an acronym. And the RISE stands for, okay. I apologize. Each slide is going to take a second, I guess, to load. And it's going to get jumped. Um, a minute. Oh, I'm so sorry. Um, Let me get back here. Okay, I'm just going to leave it in this mode because that seems to work better. Um, so RISE is a model, and it's also a framework to help support elder justice. And so when we talk about overview of the RISE model, the R standing for respect, the I for inclusion, the S for safety, and the E for empowerment. And so with each of those are broken down into under the first, which is to repair harm. And so the goal of the project is for us to work with, and I'll start from there from the beginning of the process, is that we've had a really good working relationship with Adult Protective Services. And we have worked on different clients with them over the last couple of years. And so the way that the model will work is that APS will basically, when they have clients that have more of a need. So we sort of look at our relationship with APS is that APS will take care of those immediate needs of their client and get them stabilized. And then, but sometimes the clients need a little bit more than what APS is able to do, or basically even spend the amount of time that's needed with that particular client. For example, let's say they need more case management. And so the referral would come from APS, and the referral would come to us. And then what we have required, our part of the grant was for us to hire two basically case managers, and we've hired some licensed social workers. And then we're able to work a little bit more in depth. We're able to assess and ascertain the needs of the older adult. And so where APS stabilize them, now we can work with them for as long as needed in order to provide the best care that we can. Number one, to help that we're adding in things like mental health counseling. And I think the biggest aspect of the grant, of the RISE grant and the program, is that if the older adult decides that they would like for their abuser to participate in counseling with them, they have a right to do that. It's all person centered, and it's based on the needs and the desires of the actual client. And so part of what we will do, and I'm going to try to see if I can make this bigger again, is that our goal is number one, to listen actively, avoid any type of ageist language, support their decision making, and also using trauma informed care. And so the two staff that we have hired, this has been a very sort of lengthy process for us with getting the contract signed, getting it through, and then, with everything that's happened with the government, not knowing if the funding was going to come through, we've actually now been able to hire our two members, which will go to Maine at the end of this month for training with the other two grantees that were selected. And then also inclusion, that older adults, that they will be part of the conversation. As I said, it's going to be person-centered. So it's not that our case manager is going to, sit down and create a plan with the older adult. The plan has to be a plan that the older adult is comfortable with. It's what they want. It's their desires that need to be met. And there was an example that was provided to us, which was I think it was in Maine, where the older adult did not want, so they needed housing. And unfortunately, the options that were available, the older adult had a pet, had a dog, and the housing that they were able to locate for them would not accept their pet. So the older adult elected to live in their car. And so it took a while, but finally the case worker was able to find a location for actually, what they did was they actually found an RV camp. And the older adult was able to go there, where he could have his pet, but he also had access to running water, to showers. He had some income, but there he had the safety. It was in a safe environment, which was safe for him, and he was able to have his pet, and he still had access to running water, to a bathroom, and so that met his needs. And so that's where part of understanding is that you have to take yourself out of the situation and not put your own, what you would think would be, to say, well, no, I don't think that this would fit for this, for this individual. It's allowing the individual to make their own choices, which in some cases in abuse, this older adult has not had an opportunity to make their own decisions and to make their own choices. So we talk about inviting them, making sure that they're part of the conversation, even inviting elders to participate on advisory boards, advisory councils, using culturally responsive outreach and addressing barriers, as well. And then when we look at safety, part of what is screening, for abuse, training our staff in abuse prevention, and collaborating with law enforcement and social services. So some of the things that we're going to do is, we are going to have, teams that are going to meet. We're going to do basically, review the case, and we're going to sit down with, I forgot what they're called. I know it starts with the I, the teams that we have created, which we will have the caseworker will also have, if there's legal that's involved, if there's someone from either, Harris County Sheriff's Department or City of Houston Police Department, if we need to have, guardianship there, the people that we need to come in that will make up these teams and to talk about the case, to see where it's going, and to make sure that we are on the right path with this older adult, is also key. And then the last E, empowering self-autonomy and self-determination, educating the older adults about rights and resources, their choices in care and services. And also, there's opportunities that we can do financial literacy workshops, for the older adults as well. And so that was really just a few slides that I wanted to share, but we're really excited about this opportunity. Number one, it's going to, like I said, we have a really great partnership with, our APS here locally, and with Christina Rector and her team. And we just see this as just moving the step just a little bit closer, and being able to provide older adults, especially those, and we're looking at those who are abused, neglected, exploited, any of those cases. But the case we'll receive the referral based on the judgment of APS. So we are not going out looking for clients. That's not part of the model. The referral has to come from Adult Protective Services, and then we take it from there. So we're really excited. We haven't got started yet, and so, everything has now, the stars have aligned, and, we will be able to, hopefully in November, after they come back from their training, we will be able to get started. And hopefully we can give you all an update, as we start the program.
Yes, wonderful. Wow, that's exciting. That sounds really cutting edge and person-centered, which is great. Was the I word that you were trying to find interdisciplinary?
Yes, thank you. It was interdisciplinary teams. And
Yes, that's
so I used a couple on my acronym too. I just want to make sure. So the R is repairing harm. I is inspiring change. S is supporting connection. And E is empowering their choice. And so, I mean, I just see this as such we're hoping that the pilot is still in this pilot stage. I know Canada is one, that was selected, Maine again, Houston, and then there's one other, state that is going to implement. And actually, Texas is going to have two.
Oh,
Um,
really?
they brought
Where's
in
the other
another.
one?
Um, it's not, gosh, it's one of the other AAA directors. And I'll look at my notes and I can put it in the chat. They
Okay.
just recently was selected as well. There was an opportunity to bring someone else
Oh,
on, and they said they were ready to go. And so,
wow.
what is going to
Awesome.
allow the Rise Collaborative to do is to look at an urban and a rural and see
Oh,
how
yeah.
how that works. And so we're really excited about that. So
That is awesome. Yeah. And with the person-centered, I guess in some instances, the person you mentioned that they could be in counseling with them.
mhm,
They
yeah.
they could also be creative with their repercussions, I guess. They don't necessarily have to be charged or sentenced. Is that right?
Now that I do not know. I think it
Yeah. Okay.
depends. Yes. The only thing that I know that's a little bit different is now that it's possible the person may still get charged. I don't
Mm,
I I don't remember any of that they
mm.
might not be charged, but it is possible that they can, if they wanted them to go into counseling with them, and maybe I know in some instances where the older adult might not want to bring charges, and we've seen that too, even with some of our clients, because they're like, that's the only person I have to take care of me, and
Right.
they may not want to. However, I know that the state, or I don't know, the state or the city or the district attorney can make the option to charge if they
I
wanted
see.
to. So I think it
Right.
depends on the level of maybe the level of the abuse,
Yeah. Yeah.
as well. And so, but yeah, I welcome the opportunity to come back and to give you all some updates after we get started and I have some data to share.
Yeah, awesome. Well, that's exciting that you're creating the interdisciplinary teams,
Hmm.
also called MDTs or multidisciplinary teams, or
Yes.
there's a bunch of different ways
I think in our
to
grant
identify it.
I think we
Sorry?
wrote MDT. I think in the grant proposal we put MDT teams. And so I know it was mentioned at the conference
Mhm.
gosh, was that this year? Yeah, it was mentioned at the conference from gosh, I'm just sort of worn out, but he was your speaker, he was your closer from UT.
Oh, I'm sorry. You're talking about the summit. Yeah, Dr. Jason Burnett.
Yeah,
Yes.
Jason worked with us, and so he's going to sort of be integral in the process. And so yeah,
Yeah,
unfortunately,
wow.
it's unfortunate that we have to do this. But I'm glad we have a way of supporting our older adults even more.
Right, right. Absolutely. Wonderful. Does anyone have any questions for Paula? Lindsay has a question. Go ahead, Lindsay.
Hi. I was wondering, the training that the your staff will be participating in, what agency or organization is the training through? And is that what the I guess best practices that will be shared will stem from, or will be a compilation of a few different things?
So actually, the grantor, I just call them the Rise Collaborative. The one person I speak to quite often is JT. They are actually putting the training on because they implemented the model. This is their model, and so they are going to provide the training. Um, and there's even up to now, like our case manager, my division manager, who's over care coordination, caregiver support coordination, and the Rise grant, she had to go through training as well. So it's been very training intensive, and they will. Part of it, I think, is that not everyone. The way that we already operate on a person centered, and our staff are trained to do person centered planning and working with the older adults. So a lot of it is that. I think a lot of it is as well is just how to implement the model for the case managers. And so I wish I was able to go because I would love to. I would love to just sit in and listen, but I'm going to have to wait for them to come back. But it's been the training itself it is probably going to be best practices that they learned over time um, in creating the model. And I know that may not fully answer your question, but that's who's going to do the training.
No, that's definitely helpful, and I think it's great. And I think a trauma, looking at most things, even just standard business through a trauma informed lens, I think it's really helpful in many ways. And certainly when you're dealing with a situation that where someone's been abused, or they haven't been able to make decisions for themselves. I feel that a lot of people that are in a problem solving role jump right to the solution versus skipping past what they may need as the victim or as someone who's been traumatized. So I think this is fantastic, and I am excited to hear how everything transpires. So thank you for sharing.
Oh, you're welcome. I think there was one other question.
Yes, Elva?
Alva?
Yeah, I was curious to know who is the funder for the RISE grant and what was the dollar amount, if you don't mind sharing?
So actually, I just had a document up. So so the Administration for Community Living
HCL,
is
okay.
funding. ACL is funding the grant, but they've already funded. So they funded the RISE Collaborative, and then the RISE Collaborative was able to then do an RFP. So it is federal funding for this, and it's supposed to be. I'm pulling up a document now. I had it up. Let's see. So it's supposed to be for 2 years, $473,205.
2
However,
years, 400,000, okay.
yes. However, with everything going on the federal side, they've only been given like the first year of funding. And it took a while for them to get the funding. And so we are hoping that they will get the second year of funding. It's a cost for reimbursement grant. So we're picking everything up on our side first, and then we'll have to do an invoice, the collaborative.
Gotcha.
Okay,
Yeah.
one more quick question. What does the HHD stand for? Harris something, I'm sure, but,
So HHD is Houston Health Department.
oh, okay.
So our AAA, our Area Agency on Aging, the Harris County Area Agency on Aging, we are embedded. The city of Houston has the contract for our AAA, our Area Agency on Aging.
Okay, got it. So my brother and sister-in-law live in Spring, Texas, which is part
Oh.
of Harris County. So I'll be
Yes.
sharing with them what I learned today.
Okay. Yeah, so we cover the entire county. AAAs are we're the largest AAA in the state. And just because we have Harris County, and I'm fortunate I only have one county because some AAAs have 15, 20 counties. But most of their area coverage is rural. And so I'm surrounded by the Houston Galveston. People get us confused. The Houston Galveston Area Agency on Aging covers all the counties that are around Harris County.
That's
So-
kind of like we have up here in the DFW area. Dallas County has its own, Tarrant County has its own, but then
Yes.
the North Central Texas AAA covers like 17 counties or something.
Yes.
Yeah.
Yes.
No, Pat's got a question. Go ahead, Pat.
Hi, Pat.
Okay. Yeah, Paula, you said you're gonna look up who the other area is in Texas. And I'm assuming it's gonna be a rural, because you said they were gonna look at rural urban comparisons.
It is going to be, I see, let me
Is
get
it
it.
Abilene, Paula? This is Christine. I
Oh.
think it's Abilene.
You know what? I think that you are right. In Abilene
Northwest
falls
District.
into, her name is
Yeah.
Crystal. Oh, that's an old list. The AAA, Crystal. Oh my gosh, I'm looking at all our AAA directors. Oh, here it is right here. Well, I think it's West Central.
Oh, West Central.
Yes, that's where Abilene is. So it's West Central AAA.
Okay, good. That's exciting.
Mm-hmm.
Right? Yeah, very exciting. Maybe we'll all get to be doing this someday.
And it's so good to have Christina on. Christina, if I said anything that was not
Oh, you did good. Perfect.
Christina could have did this presentation, but it's we have a great partnership, and so we're so excited to get started. And so unfortunately we were sort of the hold up because it takes a while to get things through the city of Houston to get approved through city council, and our city council members did not quite understand. They got hung up on a couple of things, and so we had to keep going back and forth and answering their questions. And then when they got it, then it's like, okay.
Great.
So
Shakita says,
Oh.
Paula, oh, I lost it.
Hi,
She said good things
Shakita.
about Paula. Yes, absolutely.
Thank you. Yeah.
Paula
One
J
of-
is the gold standard. Kudos. Yes, I think we can all agree on that. Wonderful.
you.
Thanks, Paula. Yes, absolutely. Any other thoughts or questions? Awesome. Thank you all for being here. I will continue on with the agenda. We had the Center for Nonprofit Management who did a consultant contract for us for organization and sustainability. I know some of you were interviewed and on some of the calls, and we had a presentation, and the staff is looking at it and kind of laying out the timeline for how to move things along. We have templates and action plan, and basically some things to work on for the next 6 months with our no cost extension. It will have a board. We're going to work towards having a board and a lot more structure with the committees, a little bit more explanation and agreements. Work on a fundraising plan and some marketing and communication. So looking forward to that and sharing with the appropriate committees and the coalition as we move along. The committees have been busy. The next meeting for the professional education committee is next week, October 13th. And if that sounds interesting to you, just send me an email. I'm happy to add you to the invitation so you can help us figure out our speakers. We have been discussing possibly webinars and also the summit, which it sounds like a long ways away, but it'll be here just like that. Because once October hits, it's like January in a blink. And we are talking with Paula actually about Houston in conjunction with their Bridges conference on May 8th. So stay tuned. That's not official yet, but that's what the discussion has entailed. The Financial Exploitation Awareness Committee has been talking about the kiosk, the crypto kiosk use as a way to defraud people of their money, similar to gift cards or wiring money. They have a story and then are directed to go to a crypto kiosk. So we have worked on creating a flyer. Oh, I already have it up. I was going to share it with you. We handed out some at the Empowering Seniors event last week. That's not it. There it is. And tweaked it a little bit based on feedback, and ideally we'll get everybody in the state to run out and ask their local businesses that have the crypto ATMs if we can put up some signs near the ATM so that people understand if somebody contacts them that they don't know, offers free money, prizes, or investments, says not to tell anyone, says that you have to pay first or to pay through gift cards, wire transfer, or cryptocurrency. And then tragically in 2024, more than $738 million was lost to scammers in Texas. And of course, the largest percentage of that were people over 60. So there is a link in the agenda for accessing that. If you are interested in printing it, sharing it, whatever you'd like to do, just let me know what you plan to do with it. Any thoughts or questions about that? I also included in the agenda a link if you want to edit it in Canva yourself. And the other items that the Financial Exploitation Awareness Committee has worked on include the wallet card and the Stop the Stigma campaign. And the Canva link is also there if you want to print that, and the Stop the Stigma campaign link. Everything's all right there. And the next meeting for the Financial Exploitation Awareness Committee is November 25th. So let me know if you want to join in there. And then collaboration, next meeting is November 17th, and working to create a hybrid meeting in December. Our next meeting is November 17th. Their efforts created a roster, and if you want to be added to the roster, be sure to click on that link and answer your contact details. Basically, there's a link for the flyer, which is another one of the collaboration committee's projects, and the introduction call that we have now each month that people can introduce Texas Elder Justice Coalition. If they want to learn more, they can contact me and I'll send them the details. This is the map that we created. It's on the agenda, and you can see we're still really concentrated up in the Dallas-Fort Worth area, but happy to have our Houston and other location friends on today.
Dana, we're not seeing your screen.
I realized that when I said
Okay.
the map was on the agenda, yeah. Yeah, it's okay. The map is on the agenda if you want to look at it. The Resources Committee, which is about sustainability and data, the next meeting is Tuesday, October 14th, which is next week. There were some grants submitted. We still haven't heard back, and we were declined on our Office of Attorney General funding request, and we did get the no-cost extension. If you haven't heard me say that before, but yay. We're good till March. My email is in the agenda as well if you want to join a committee, or if you have questions, or if you know somebody that would like to join us. Social media stats have been slowly growing. This month is Financial Exploitation Awareness Month, and I've been posting red flags and did you knows and other social posts on all the LinkedIn, Facebook, and Instagram, and we'll continue to do that throughout the month and encourage you to follow and share. That way we can continue to spread the word. Our next meetings continue to be the second Wednesday of the month at 2. We have November 12th, and I'm not sure who the speaker is going to be for that one yet. And December 10th will be in person or hybrid if you're unable to make it. And we'll be collecting items for the APS Silver Star Room. And I'm happy to take any suggestions for topics or presenters, anything you're curious about or want to know about? Anyone?
Dana, I'll just point out that my camera's going on and off. Anyway, that this Saturday, the UTA Healthy Living and Longevity meeting meets at Trinity Hall from 10 o'clock till noon. And the speaker this time is going to be a PhD professor from UTA that specializes in materials, and she's going to be speaking about micro and nanoplastics, which is a real big interest of mine at the moment. I can't wait to hear what she has to say about that. But anyway, it's free to join. There's close-up parking. It's easy to get there. And if anybody wants the flyer or more information, they can email me at elvaroy@gmail.com, and I'll be happy to send them the link,
Fabulous.
or
you.
just show up at 10 o'clock.
Gotcha. Yes, Lindsay?
I think that a session that would be interesting would be something related to trauma-informed best practices.
Mm-hmm.
Just
Okay.
as
Right?
that's all. That was all. That's my only suggestion for now.
Thank you.
Sure.
Any other thoughts? Anything you've been just wondering about? Okay. We will find somebody fabulous, and it'll be great. So I did the presentation for the abuse, neglect, and exploitation meeting in Houston. And one of the things that they requested was a resource list. So I did go ahead and take the information out of my presentation to create this. And there's a link to it in the, I can make this smaller, can I? A link to it in the agenda as well. There's the size thing. Okay. So it's got the web links for fraud and scams, and then adult protective services if it's a trusted known person, some resources for information and data, and then victim support through Give an Hour and ARP. All in one handy dandy place. Again, that's in the link in the agenda. Instead of
You've
attaching
been
a whole
busy,
bunch
Dana. You've been busy. You've done a lot. Yeah.
Oh, thank you. Yes. And yeah, instead of attaching a bunch of documents, I started uploading them to the website and then creating links in these so that it is easy to access. Okay, new business announcements. Anyone? Any questions about anything we covered? Anybody excited to access any of the resources I just talked about?
Dana,
Yes.
it's Shirley. I have just a really brief
Hey.
question for you.
Yes, sure.
Is it possible, so we go to a lot of events here
Mhm.
at Capital Area Council, Area Agency on Aging, and I was just wondering, is it a possibility to the flyer that you have for elder justice is wonderful, but it's the issue, I guess it's not an issue, but I'm sort of looking at just another option. Is it
Mhm.
possible to have a flyer that's just one page? Because that seems, we put out a lot of information at events and like one
Mhm.
pagers, and I'm just wondering if we could produce that into a one page flyer.
And you're talking about the one that's just an introduction overview of the
Elder
coalition?
Justice, yes, ma'am.
Yeah, sure.
Is that
So,
something, I, is that
yeah,
something that, like, I would be willing, to speak to my colleagues who do a lot of flyer designing and they're real good at it. And I was just wondering if that would be something, if I had the template, if we could present that to you, if we were to add something to it, or I'm just asking if that's a possibility. Just seems like
sure.
a one pager would be very convenient for people to see on a
Yeah.
table and hand
I
out.
I understand. Yeah, yeah. Let me see.
Okay, thank you. Thank you for your
I
considering that.
Oh, for sure. Yeah, I'm going to share my screen just to make sure this is the one that you're talking about, right? That's 2 pages, is designed to be front and back. But I get what you are
Yes,
saying.
yes,
Yeah, we could compile all that into one. Just one-sided, yeah.
yes,
Okay,
yes, exactly.
okay.
That's just my thought, because we go to a lot of events and I'd love to be able to hand this out at our events so that people
Right.
are aware, have awareness of the coalition. So thank you for your
Yeah, that's
consideration.
awesome. Oh, for sure. Yeah, thank you. Oh, that's
Yeah.
great. Yep, sounds good. All right. Anybody else have any requests or questions? Awesome. Thank you all for being here. Thank you again, Paula, for your presentation.
Oh, you're
Looks like
welcome.
we have 15 minutes left that you can have back to your day. So I will see you next month. Thanks so much.
Have a good day. Bye-bye.
Thanks.
Thank you.
Bye.
Thank you. Bye-bye.
Dana, those are great resources.